Good evening, good afternoon, good morning, everyone. So wherever you are, you can be from Europe, you can be from the US. Welcome. I see that we have already more than 30 people attending. Good evening, Ron. How are you today?
I'm good, very good.
Good afternoon for you, because it's 1 p.m.
Right.
for our friends from the US. In Europe, it's more between 5, 6, 7, 8 p.m. So thank you, everyone, for joining us now for this third or fourth webinar already spoke by Dr. Ron RIEGEL. Today we have another webinar, and we're going to tell you a little bit later about more webinars coming during the rest of this year in 2022. I'm really happy to have you today. I'm Remy from Mano Medical, in charge of the exportation. So this webinar today, spoken by Dr. RIEGEL, is organized by Mano Medical. That is part of the Genia group now. So that's why I'm going to explain to you a little bit so you will understand how is our organization. I'm going to start by sharing my screen and explaining to you a little bit how all of that works. Then what's going to happen is that Dr. RIEGEL is going to speak for about 45 minutes on today's topic, and then we'll have 10 to 15 minutes time for questions. So please feel free to ask your questions on the chat box on your screen, and we'll try to answer as many questions as we can at the end of the webinar by Dr. RIEGEL. So now I'm sharing my screen. Okay, so Mano Medical has been created 20 years ago, and we are a company specialized only in veterinary equipment. We are around 20 people working in the company in France, and I have the pleasure to be the one trying to export all of our products outside France. So that's why you are from Portugal, from South Africa, from the US today, attending this webinar, because we really want to try to bring you education. Okay, last year the company was purchased by Genia, so we are part of the Genia group. Genia is a French company also, but that has a subsidiary all around the world. And today this webinar is organized by Genia USA. That's why we have a time at 1 p.m. Eastern time to try to be relevant for all our friends veterinarians from the US. As you can see on that slide, those are the 9 ranges of products that Genia is doing all around the world: injection, surgery, orthopedics, capture, grooming, livestock, etc. So with the Mano Medical product, we provide a complete offer for the animal health. The company was created in 1945. As I told you, we have branches in France, USA, Hong Kong, and Australia. And our goal is to provide to the veterinarians high quality products to elevate their practice and try to improve comfort and hygiene of the animal. As I told you, we are all around the world. We are more than 125 people on 5 different continents. Today is organized by Genia US, that is based in New York. As I told you, this is the 3rd or the 4th webinar. The replays are already available on our YouTube channel, the Mano Medical YouTube channel. So you can go and take a look at the webinars from before that I've done Ronald RIEGEL. And today the topic is integration of laser therapy in your practice. And we have more webinars coming. So we have one in April that is about using laser therapy as an integral part of your pain management. We have another one in June, which will answer the question, how does laser therapy accelerate wound healing? And another one will be in September of the benefits of laser therapy in canine rehabilitation. Okay. Ron, that is going to speak today, is the co-founder of the American Institute of Medical Laser Application in 2009. He provides education on all types of medical lasers in both veterinary medicine but other healthcare professions. He has authored more than a dozen papers and books on equine anatomy, both equine and companion animal therapy modalities. And he was the co-editor of a book that we've been using a lot and we sent to some of our customers, the laser therapy in veterinary medicine, Photobiomodulation. Okay, so as I told you before, wait until the end. We can answer all your questions. Please write your questions on your chat room, and we'll try to answer them at the end. You can write me to my email or WhatsApp me on my phone if you want to know, if you have any more questions, or if you want to know who are the distributors in your country, if you're today from Portugal, as I said, Germany, England, or USA. Okay, so I'm going to stop sharing my screen now. And Ron, it's your turn now. I'm going to leave you the possibility to share your screen. And I'm going to tell you if we can see your screen now. And now I'm going to back up and let you speak for 45 minutes. I see you in 45 minutes.
Okay. Well,
okay.
It's not sharing yet.
Yeah, I can see your screen, so you can put it full screen now if you want.
Okay. You can see the whole thing, huh? Well, that's good. There. How's that? Is that full screen?
Perfect. Thank you so much.
Okay. Yeah. Thank you. Well, welcome everyone. Welcome colleagues, veterinary technicians, nurses, practice managers, and all others interested in laser therapy to integrating laser therapy into your veterinary practice. This webinar is for those who have just purchased a therapy laser or have one purchased just recently within a period of time and are wondering how to integrate it into their practice, more efficiently, or you're considering purchasing a laser and you're going to figure out possibly how to pay for it and, with return on investment here. Or you have a laser and you want to utilize it better every day and you're not aware of the versatility of this modality here. So I have a few things to disclose. First, I am the co-founder of the American Institute of Medical Laser Applications. We're basically non-profit, non-denominational. We provide training and certification to various laser manufacturers and healthcare professionals. This is the textbook that Remy had reference to there, and I authored myself 7 chapters in here, but I'm the co-editor of it, along with Dr. John Godbold. And again, I published quite a few papers already. I'm a fellow in the American Society of Laser Medicine and Surgery, membership in the Optic Society, and several veterinary medical and medical advisory boards, all of them having to do with laser therapy. But I also want to give thanks to Nanomedical myself, because without this opportunity, I don't get to share all the experience that I had with my colleagues, because it took me many years to gain all this knowledge, and I want to give back to the profession, give back to my colleagues here, and this is one way for me to help do that. So giving you a little bit of history on myself here with the therapy laser here, as I own my own practice for more than 25 years before I sold it. I was the sole owner. I had 2 clinics, many veterinarians working for me, quite a few employees. And I bought my first therapy laser actually in 1979. So that was a 1 milliwatt laser from China. So I spent $3,200 US on that. And it was a 1 milliwatt laser. Right now you can get a laser pointer that you use in a lecture to give a lecture, and that's 5 milliwatts. So I spent $3,200 for a fifth of what we now know as a laser pointer. So I had to start way back in the beginning. It was good for stimulating acupuncture points, but not particularly effective for many other things. But I believed in it, and I kept trying to increase the power all the way through the years. And again, at around the turn of the century, the class 4 lasers came out, were the higher power lasers. And, again, that has increased now to that there's some on the market, therapy lasers that are actually 60 watts. Again, I co-founded AML in 2009. So what we're going to cover today is what laser therapy actually provides to the patients and the practice, and understand the versatility and the mechanism of action. I have one slide only with scientific evidence-based medicine, just to show you how much literature is behind this modality. And then I'm going to go through some clinical applications, pain management. It's going to be a brief summary compared to what the future webinar is going to be like. I'm going to go through acute chronic case applications, rehab, sports medicine applications. And then I have basically what I tell everybody of 5 steps to revitalize or implement laser therapy into your practice. So the first thing we have to do is build a foundation. You have to make sure all the staff, the veterinarians, technicians, nurses, even the receptionists should know the versatility and capabilities of this modality. Now, the receptionist does not have to understand how laser therapy works, but the veterinarian should, so then they can extrapolate that information into clinical applications and understand, and I'm going to show you examples of the versatility of this modality. So in other words, in order to be able to use it and have everybody in the practice on the same page here, you need to have a foundation of information, which I'm going to supply you first. Laser therapy really does 3 things. It relieves pain, modulates the inflammatory response, and increases microcirculation. And why I got so excited about it years ago is it's an acceleration of the healing process, using basically the body's own systems to heal itself. It's a stimulation of that biochemical cascade of events to cause that healing reaction to be a lot faster without having, use pharmaceuticals. We have all kinds of tools at our fingertips here, but here's one that was non-invasive, easy to use, could only do good. You really could not overdose somebody on it. And I can, that's a whole subject on itself. But over the years, the dosages have increased, and I have some of the dosages listed on here, but those are the 3 clinical results that result when you apply laser therapy to your patients. So we all want to practice scientific evidence-based medicine. So just about a week ago, I went on the PubMed website here, and which is listed right there, www.pubmed.ncbi.nlm.gov. And I went through and I added up all the articles that were published on laser when I put in low-level laser therapy from 76 to 2022 as of January of 2022. And there was 8,732 articles. If I put in LLLT, there were 7,500. Photobiomodulation, there's less, because that nomenclature came to effect only about 5-6 years ago. Veterinary laser therapy, 846. Now I removed all the duplicates in here, and I still had 16,229 publications. And just since January till the end, just during the month of January, almost to the end of January, there were 10 papers on veterinary laser therapy and 57 on photobiomodulation, which included medical as well as veterinary, and 3 papers on low-level laser therapy. So you can see this is very well scientific evidence based. I mean, and again, just to give you some comparison, ivermectin won the Nobel Prize in 2015. It was discovered in 1970, and they only had 6,283 papers, because a lot of people would, very few now, but years ago, people would say, well, there's no evidence for that. Well, there is, and there's a lot more evidence almost for anything else that we use in practice. So again, we're research evidence, and clinical evidence is evidence-based healthcare, and that's what we want to provide to our clients. We want to give them the best possible care every day that we can possibly give them. So it's no longer, does laser therapy, photobiomodulation work? It's now, what new applications can we use it on? And I'm going to give you a crosscut, a tip of the iceberg of a lot of different applications that you might be using the laser somewhat now in your practice, or you maybe where you're considering buying one and you now want to know how versatile it is in practice. So I'm going to cut across the whole gamut here and just briefly give you tidbits of little pieces here to give you an idea. The first thing we're going to talk about is pain management, because that is exactly what it's basically is licensed for by our federal Food and Drug Administration, and pain management is something that's very effective using laser therapy. And if you ever have the opportunity and you do hurt somewhere, is apply laser therapy to it, and you'll be amazed how quickly the relief is. Now, how much percentage that is depends on the patient, depends on the condition, all those things, but you will get an analgesic effect almost immediately. And how does that happen? And again, we're not going to go into any of this stuff right now, but it's a biochemical and physiological cascade of events that results in the reduction of pain. So I administer photobiomodulation therapy, and all these things happen simultaneously. Whoops, sorry. Simultaneously, you get a nitric oxide production, you get an increase in our beta endorphins, you get a decrease in our antagonistic cytokines like bradykinin. We get an ion channel normalization, serotonin release. We all love our serotonins, and again, that becomes important with lick granulomas. Acetylcholine release and block depolarization of C afferent nerves, and it actually changes the action potential along the nerve cell surface. So all those things happen simultaneously, happen in different conditions, different circumstances, but all those are well documented. You can see all those literature references are quite old, because those papers have been around for a long time and duplicated and repeated, many times. So integration into your pain medicine protocol in your practice, we all want to have pain-free, fast recovery for our patients. We now have, at our fingertips, a lot of things to do. We have a multi-pharmaceutical approach, of course. We all provide good nursing care and post-op rehabilitation, But now let's add to that photobiomodulation or laser therapy. And what I'm talking about is cases of acute pain like trauma, burns, otitis, and dental. I'm going to give you some example of those. Chronic pain, the biggest example of that, of course, is osteoarthritis, but there's other chronic pain situations, which I'm going to touch on. And then surgical, during our surgical procedures, I'm going to show you how to use it throughout your surgical procedure here. And then we have the dermatological, abdominal, respiratory, renal disease, and a myriad of others. I could fill this whole page with applications, clinical applications that are proven to be effective, laser therapy to be effective. Again, you want to integrate it into all your pain management protocols, whether it's, an acute case, a chronic case, a neurological case, something that even possibly not a definitive diagnosis on. So it'll help. So acute pain management, of course, number one is surgery. Just right off the bat, that's the first thing you're going to think about. And integrate it into your practice that way. Dental procedures, I almost put these in order of use for pain management clinical uses here. Burns, otitis, urinary disorders, otitis should probably be up near the top there, gastrointestinal disorders. And then when we talk about chronic pain, we talk about osteoarthritis and geriatrics. Those are kind of synonymous. Most of our geriatrics do suffer from some degree of osteoarthritis, dermatological disorders, and respiratory disorders like feline asthma. How many are using it to treat? If you already own a laser, did you even know that you could use it for feline asthma? And I'm going to show you a case of that as we go through this talk. So again, integrate it into all your surgical procedures. This is an easy first step to integrate laser therapy into your practice. So you just basically do everything that you've done surgery on, but I'm going to expand on that. It's not just post-op, it's during the surgical procedure and even preoperative. So routine surgical, orthopedic, traumatic, dental surgery, any surgery that you do, you can work laser therapy into that, and it's scientifically proven that you will have less pain afterwards. You will have accelerated healing from it. And again, that's our benefit here. And I'm showing an example on the side here of after a bladder was closed with a case of stone removal here from that bladder, and you can see that the laser is being administered to that incision line there on the bladder, and then the bladder simply dropped back into the abdomen again, and then the closure occurs and you're actually lasering the incision after closure. But that's an example of using it during the surgical procedure itself. And what you do is you just add an additional fee to your surgical procedure. So your client, that's your standard of care. You're going to provide this to your surgical cases. So you charge for it. And that surgical fee then is just increased just a little bit, even if you only increase it, 5%, 10%, just a few percent. And that right there, if you multiply that times the number of surgeries you do in a week, will give you a return on investment immediately without having to think about doing anything else. So let's show you different, perioperative pain management procedures. All three phases of surgery here. We got preoperative, and it's been shown in the literature since 2017 in the oral cavity and even in laparoscopic, surgical procedures, that if you laser that area first, the patient does not experience as much pain and the recovery is faster. Intraoperative, again, I showed you an example of that with that bladder case there, but I'm going to show you some others here in a second. And then post-operative. The biggest push on that was back in just 4 or 5 years ago when we were trying to decrease the amount of opioids that were prescribed after surgery in this country in the human side. And again, they proved that you could get the same amount of pain relief with laser therapy as you could with the opioids. And again, you could discontinue the opioids and use the therapy, laser therapy, and then over-the-counter medications. So here's just some examples here that I wanted to show you. This is the first one on the upper left is from Woodland Springs Veterinary Hospital in Fort Worth, Texas. Again, that was a bowel anastomosis, and you can see that the laser is being administered there to the incision line. And when you do that, and I've done it many, many times, you can actually see the tissue pink up. My surgical skills could always need improvement, and I was pretty traumatic to some of the tissues because of being in a hurry all the time. And of course, when you lasered them afterwards, you could actually see some of that perfusion of the tissue return that you had possibly, curtailed by your incision. The dental case on the right-hand side there, you can see that that was taken not long after the extraction of those teeth, and you can see how inflamed the gums are and how, basically all the gingiva and all the surrounding areas are very inflamed, very inflammatory in nature. Those teeth were removed, and of course that helps the whole process, but it was lasered, and this was just a few minutes after being lasered, because you can see the endotrache tube still in the patient here, and you can see how nice and pink the tissues are and how good the incisions look after that procedure. I actually have a whole series of slides on this showing every stage of it, but the really before showing you how inflamed it is, and afterwards how basically that inflammation has been reduced, really helps show, illustrate the applications and the dental surgeries. And then the picture on the bottom left is just a simple incision that was basically being lasered afterwards. And I'm going to show you some more examples further on here to show you the benefits of that, how those incisions are going to heal a lot faster. If you don't believe, or you're still a skeptic, the next few surgeries you do, and you do have a laser half your incision and not the other half. You do have some systemic, effects to the whole incision, but you will see a difference just in that within 24 hours. So let's talk about acute musculoskeletal pain. We have back pain, toenails, sprains, strains, all those things, hot spots, abscesses, wounds, anal glands, otitis, dermatologically wise, parvovirus, pancreatitis, colitis, anything that ends in an itis here is going to be, responsive to laser therapy. And acute urinary pain, that's something a lot of people don't use the laser for, but they should, and I'm going to touch on that here in just a second. So let's use some common cases. This is a cat that jumped on a hot stove that wasn't just recently turned off, and of course he burned his pads. So it doesn't take a whole lot of dosage on that, 1 to 2 joules per square centimeter, a few minutes to treat it, and you will actually witness the cat being more comfortable, not as painful. He'll be able to put his foot down a little bit where he probably wouldn't touch it before. Otitis, the advantage to laser therapy on this is we can treat the outside of the ear off contact and the inside of the ear by treating them on contact. And Mano Laser has a specific handpiece for that allows for a really good transfer of the energy from the piece of equipment, from the laser itself, in through the dermis and into the inner structures of the ear. So treating off contact and on contact is very efficacious for these dogs, and a lot of times it's the key to getting some of the chronic ones absolutely into the cure category here. Cervical disc pain, of course, that goes without saying that there's a lot of pain there, a lot of inflammation going along with that. And again, you have to use a little bit of a higher dose to get deeper into the tissue. This is a smaller patient here. This patient weighed about 20 some pounds. So it really didn't take a whole lot of energy to get in there, but you're going to, laser a couple of vertebrae above and a couple of vertebrae below. And just edema and pain control on a post-emiticide. We have a lot of heartworm problems here in the United States, and the emiticide that we use to do that usually causes a tissue reaction, which you can see as a swelling in the bottom left-hand corner there. And then on the right-hand corner, you can see 24 hours after one single treatment. Now, some of that goes away on its own, you say, right, they absorb the drug and it's not, the body's own anti-inflammatory response help, but it's a huge difference when you use the laser after that for the management of that pain and swelling. And this case was given to me by my colleague, my co-author on the foot laser therapy textbook. Urinary tract pain, this is usually a new concept to a lot of people that have a laser, and should be, when you're just now buying or purchasing a laser, you should consider using it right off the bat for this, because it's very effective for this. And again, the treatment techniques and protocols for these things are a lecture in themselves. So I'm just giving you examples here. Gastrointestinal pain, there's your dosage. As long as the light can get to it, it's going to help relieve the pain there, relieve the inflammation there. Chronic pain management, my definition of that is that they've been in pain for more than a month, which is terrible. I mean, that's quality of life, constantly in pain, and the stimulus may be persistent, like osteoarthritis, or it may be absent, like the central nervous system malfunction or wind-up central neuronal hyperexcitability. And I have a bad case of osteoarthritis up on the top there, chronic osteoarthritis, chronic dermatological, chronic respiratory conditions such as feline asthma, and then chronic GI conditions. There's actually a couple of papers out on helping to manage IBD in the canine. This is a paper that I just pulled out for one reason, is to show you that when you start using laser therapy, of course, you're going to use everything in combination. You're going to put them on non-steroidal anti-inflammatories possibly at the same time. But this paper that was presented back in 2018 from a group in Canada, I know Andrea Looney and Janice Huntingford personally, and basically they showed that you can reduce the dose of the non-steroidal anti-inflammatories, and they reduced it in 9 out of the 11 dogs in the laser therapy, the photobiomodulation group, and none out of the basically the control group for the study. So osteoarthritis, the important thing with that is to not just treat the area that you know where the osteoarthritis is. You want to treat that whole area, putting it through passive range of motion and circumferentially around the whole joint, but you also want to treat all the secondary compensatory areas. This dog here, there's an infrared thermograph down on the bottom right that has the white areas and the red areas are areas of increased circulation, and it's showing that this dog here that has hip dysplasia is also, and the stifle problems, is also exhibiting a lot of pain and inflammation in his lumbosacral spinal area. So it's important to treat all your patients holistically. Treat the whole patient with the laser, not just at one spot here. Chronic otitis, again, a pretty high dose, again, because you have a very difficult area to treat. There's a lot of nooks and crannies in the ear canal itself, plus it's always inflamed and swollen. And again, the external structures are treated off contact and the ear canal on contact. Stomatitis, here's one. All the ones I've given you so far have a very high success rate, 85, 90% success rate. Stomatitis, not so much. Over the years, I've experienced and had reports from the field of about a 60% success rate, and I think that's my own opinion, is that it's due to the autoimmune component of stomatitis. But here you can see 6 treatments over a 2-week period of time, and this was back from 2010. This was 12 years ago. Just a small dosage there, and the nice thing about having an on-contact head on your laser equipment is you can actually treat them with their mouth closed. Yes, keeping their mouth open while you're treating a cat is difficult at times. You have to, of course, protect their eyes. But again, this is 6 treatments over 2 weeks, and that's 30 days later, and you can see that most of the stomatitis has been resolved. Chronic pain, when you have degenerative joint disease or degenerative, osteoarthritis, anything like that, again, you want to treat them 3 different phases. You want to treat them very aggressively at first. It's almost like a loading dose of a pharmaceutical. So in other words, we want to give them at least 3 treatments, maybe 3 out of the first 4 days, maybe 3 out of the first 5 days. It depends on people's ability to get back in. You can also correspondingly treat the acupuncture points that go along with that area. That actually gives you a little bit of a better response, and it doesn't take very long to treat the acupuncture points at all. It only takes a few joules, for example. Then you want to back off that frequency of treatment a little bit as you gain ground on it and as you're reaching your clinical goal on this. And then, of course, when it's a chronic problem, you're going to have to maintain them. Now, does that every 3 to 5 weeks? Is that once a week? Is that twice a week? Is that once a month? Is that twice a year? Who knows? Depends on the time of year and the condition you're treating. But you're going to have 3 different phases. And unless the clients comply to all that, they're going to be back in, and you have to start over with the aggressive treatment on the first phase of that treatment cycle. Feline asthma. This case came to me a long time ago from a colleague in Norway, which is listed at the bottom there, Dr. Thorsen. And again, it's going to provide pain relief, reduction in inflammation, and quality of life. You get that endorphin release. These patients feel better right off the bat. They're breathing easier, taking the inflammation out of the lungs. And he treated them, this is his protocol here, 3 out of the first 4 days, then 3 times per week, then once a week till managed. And then he said his most of them responded by 6 or 8 treatments, so within a couple of weeks. And again, that was the before radiograph, and that is after, and this is actually at 4 weeks after the first one. And you can see there's a lot of reduction of the inflammation in that lung tissue there. I mean, and the animal was, of course, clinically a lot better. Now, here's one that I think is really an important application that a lot of you probably don't understand, but I'm building a base here. You have to understand where it's applicable in order for you to prescribe it. And there is, evidence of all these things. And again, chronic renal disease, again, the dosage is not very high. The key is administering it properly, and you want to get it over the kidneys at all angles, twice daily. This is one of the few things that I'll tell you to treat that benefits from twice daily treatment, especially when they're in basically a state of distress here, then twice weekly till your blood chemistry stabilizes, maintenance levels to effect, and then monitor the blood chemistry results. This was shared with me with Ron Hirschberg in Brockton, Massachusetts. And again, if you think about renal disease, it makes perfect sense because we get a release of nitric oxide, which is a vasodilator. A lot of those are vasoconstricted in nature. We get a reestablishment of neurological function to the kidney tissue itself, plus all the blood supply to it. And we get that serotonin and endorphin release, which stimulates the appetite, improves quality of life, and alleviates that depression and relief of pain. So just with those little few facts, you can understand how this is so efficacious for that. And the same thing goes for our canines. 10% of the canine population is going to develop kidney disease. So if we have a dosage, a way of managing that, especially, you're going to use all the tools at your fingertips, but this is something additional to do that will really be a benefit here. Other chronic conditions, IVDD, which I touched upon earlier here, degenerative myopathy. Again, the study came out where the average lifespan was, just a few months to increasing that lifespan quality of life to over almost a year. 255 days was actually the study results of it. The original group was only like 60, 70 days. Pancreatitis, again, if you can reach it, you can treat it. Liver disease, chronic dermatological disorders. Most of your dermatologies don't take a very high dose except for lick granulomas. We started treating those at a very low dose years and years ago, and we found out the more we increased the dose, the better they became. And we found out also that because of the increased dose, we get an increase in serotonin release, which treats the basically compulsive disorder that causes that licking. Now, is it a 100% cure? Absolutely not, but it will stop the vicious cycle dead in its tracks for at least a period of time. Every once in a while you got one that did not lick again, for whatever reason, but a lot of times they do reoccur, but not nearly as often. And then feline lower urinary tract disease, again, you have to positioning the patient is key to doing that, and that is another whole lecture. So inflammatory reactions, of course, inflammation is what we really, anything that ends in an itis is very responsive. Again, there's a biochemical cascade of events here, which I'm not going to go into, but just to show you, and you can review this again, or even email me and I'll send you a copy of this PowerPoint presentation if you want to really get into some of these things. And again, you want to reduce that acute inflammation. Now, you still go through all 4 phases of the inflammatory cycle. They're just shorter. Again, this is a classic example, and this is my colleague, Dr. Godbold's case. He had a dog came in with a hot spot. He did not do anything but clip it and wash it with saline and then administer 5 joules per square centimeters for a total of 600 joules to that area. And this is what it looked like in 3 hours. Now, the client dropped that patient off and then came back and picked it up. And they said, oh my gosh, he's better already. And that's what laser therapy did. So again, this is an inflammatory response that immediately responded to laser therapy here. This is an incision that was not lasered right after surgery and was lasered the 24 hours after surgery. And their concern was, of course, the staples. You do not have to worry about applying laser therapy over any metal. It reflects light. It does not absorb. It does not heat up. And again, this was post-op after 3 treatments, and you can see a dramatic improvement there. Was the dog on any systemic anti-inflammatories? This one actually was not. And this was a TPLO surgery with a lot of bruising that took effect here. So again, accelerate tissue healing. Lasers love to heal tissue. There's a documented biochemical cascade of events that happens, for that mechanism of action to work. And again, it's reducing the healing time. This case was my epiphany for that. This was a jumper, a Grand Prix jumper that on March the 10th was presented to me with that tear in the tendon there. And as you know, that's usually at least a season-ending, if not a career-ending injury. And this was a rather expensive horse that, what do you do here? Well, I had some luck, but this was, oh my gosh, this was back in 2009, I think, is when I did this one. I gave him 12 joules per square centimeters at 10 watts off contact. If I treat him now with the new hand pieces we'd have, I'd treat him on contact. He got 3,500 joules. I'd probably give him more than that now. He received 16 therapy sessions and passive range of motion and hand walking, and that's what he looked like at 45 days. And what I want you to see on that ultrasound there is that we did not replace that injured tissue with scar tissue. that is actually normal tissue in there, because that's the problem with these. They scar in, and which is inelastic. The horse goes out and jumps again and has a new tear. So they, recover, and they start to begin training again, and they don't get very far in training, and then he's lame again. Well, when you're using laser therapy on this case made me a believer right here. I mean, after that, I started really going to town on treating almost everything I could lay my hands on with this, because I saw it from my own eyes. And I mean, here's what happened else. March 10th, he had that injury. June 28th, that horse was back in competition at the same level and placed 6th, which was about where that horse should place all the time. He wasn't that great a horse, but he was still good enough, and it was that lady's horse. That lady's, key athlete, so it was worth it there. Now, this is a 19-year-old trail horse that was a case given to me by Courtney Marshall, a veterinary technician in Canada, and this was her horse, unfortunately, but a 19-year-old trail horse. She just rode the trails, and she lives out in the western part of Canada, where the mountains are, comparable to some of the mountain ranges all over the world that are very high. It's not the Himalayas, but it is the Pacific range of the Rocky Mountains, which are very high, very steep, hard trails to ride over. This horse had a degloving injury, and that was what it initially looked like. She basically gave it lavage, moist wraps, and she borrowed the clinic's laser and administered laser therapy. She called me, asked me what to do, and she sent me, I bet you she sent me close to 80, 90 photos of this thing. She almost gave me a daily log of where this horse was, and she never had to trim this flap off, that flap of skin that's on there that was part of the degloving injury. And as you're going to see here on day 22, this thing is looking really good. She actually on day 32, that's only 10 days difference in time there, but she was diligent about lasering it almost every day, at least every other day, and lavaging it and changing the wraps on it. And at day 30, she actually took it out to ride again. I wouldn't have probably recommended that if she'd have asked me, but you can see how that flap adhered back and helped heal this. I mean, if it was me, I probably would have cut that off to start with, but she didn't, and she healed it well, and that was at day 42. And the horse was back again. There was elasticity in that tissue, so it was not scarred. It was not a contracture area there, so the horse was very sound, and that was 3 years ago. And actually, I heard from her about 6 months ago, and the horse was still going strong. So fractures, here's again another, a lot of people, you have a laser therapy and they don't even think to use it post-op on a fracture, but this is a different case here. This is the late union fracture. This was a 2-year-old pug sent to me by a colleague in Indiana. It's a state, right in the center of the United States. And due for economics, the clients opted for external fixation with metasplint. And we all know the risk of that, and it was explained to the owner they just could not afford to have the orthopedic work done on it. So they did the best they could, and that's what it looked like in 4 weeks. So, of course, Dr. Kim called me, and she said, what do I do with this? She said, I don't know, can I get the laser in there to do it? And I said, yeah, absolutely. Cut a window in the splint and apply the therapy at all angles twice a week for 5 weeks. And I gave her the dosage. So that's what the radiograph looked like at 4 weeks post-fracture, post the initial event here. And then after 5 weeks and 10 laser therapy, look at the healing we have here. Now, there was nothing else given to this. The splint just had a window in it. When it came in for changing of the splint, was not very regular, but there I have the original x-rays on the right and the finished ones on the left there. And you can see that that was totally due to laser therapy. Regenerative sports medicine, rehabilitation, use it in your practice. I just put one paper up here because this was a 55% increase in muscle performance by this study. Again, this was 80 patients, and so it was a very well-documented study from 2011, and a 55% increase in muscle performance. So now think of where all the things in practice that you can apply this to. If you do have canine athletes in your practice, ideally after hard work, maintenance therapy, and then day before in detail the day of the event. We have a lot of agility dogs in this country. We have a lot of, obstacle course dogs, working dogs. Costs a lot to get those working dogs into that stage of training where they're actually helping the firemen and the police force and the military. And so this is an ideal treatment for them. So if you have some of those patients in your practice, don't be afraid to apply laser therapy to them to help them through their aches and pains of every day. At the racetrack, ideally after a hard work before in the detail the day of the race, again, the minimum the day before and the day of the race, and you're going to not at all basically take any of the pain away that's going to allow them to race if they're lame, but it is going to allow them to recover a lot faster. I did many athletes at the racetracks, and we felt we maintained their performance really well by doing that. The 100 jumpers, you saw my jumper case there earlier, but again, you can use it as a maintenance of the lumbar spine, the lumbosacral musculature, around the semimembranosus and semitendinosus muscles they use to propel themselves over the jumps, stifles, hocks, and ankles as needed, twice a week, each day at the event, minimum the day before the event, before they left. Things like that. Western pleasure horses, if you give them a high enough dose, most of them will calm down. And there's acupuncture points you can stimulate that about 80% of them will relax after you stimulate those. Again, dressage at lumbosacral area and the right at the pole of the base of the skull there, and your temporomandibular joint syndrome. Cutting and reiners, they work hard for a living, and you just have a lot of places you can apply it to on there. Your physical rehab program, it's going to modulate pain in order to perform your physical rehab. I mean, we're basically trying to return them to function. So we want to decrease that inflammation, and promote the healing as fast as possible. And again, study after study substantiates this, not just in the veterinary field, but also in the human field. And it relaxes the patient before the physical therapy session. So a lot of people are administering it before and then after they do go through physical therapy. Again, if you're harvesting stem cells or using PRP in your practice, if you laser that area before you harvest your stem cells, you're going to get a higher count of stem cells in there. And then again, people say, well, you shouldn't laser them after you inject intra-articularly. Well, that's a myth. Just put it that way. Post-administration, 24 hours after, 48 hours after you've administered that, you can laser that joint, but then those stem cells have already started to divide and do their work. So be able to use it in all facets of the practice here. So now I've given every one of you a good foundation on what you can use this for, how you can use this. So now let's step one. How do I initiate laser therapy, or how do I revitalize it in my practice if I already own a laser? You want to review your practice, and are you charging correctly for it? Are you charging every time you use it? Are you charging for multiple areas now that maybe you just did one area, and now after hearing what I've had to say, maybe you're going to do both stifles and lumbosacral area when the dog has basically one stifle that's giving him problems. So now you've got 3 areas to treat instead of 1. Make sure you charge for that. Are you utilizing the versatility of this modality? Are you covering all the bases that I'm showing you here that are a possibility? And are you marketing this service to your clients? Are your clients aware of what laser therapy can do? So review all those things in your practice, and then get everybody in the practice on board. Everybody understands laser therapy and can basically communicate the same message. You don't want one doctor in your practice saying, well, I don't know, I don't believe in it. And another doctor saying, we really need to do laser therapy on this patient. I want you to come in twice this week, twice next week, or whatever. So are you utilizing every market opportunity in the practice? So client communication here and having everybody have the same message. I hired a lot of veterinarians over the years that were skeptical because they just were not familiar with it. And if you're not familiar with it, it's just, we're safe in our little comfort zones. We don't want to come out of our comfort zones unless we have to. But once they understand it, they're on board with it, and they're going to encourage people to use this modality to its fullest here. But ensure that the entire hospital communicates the same message. When you're asked how does laser therapy work or what it is, you should all have the same answer. And I'm going to give you some samples of some of the answers that I used over the years. And phrases you should avoid is try, could, I would like to, maybe we should. Those give your clients a question of doubt. That is it, does it work? Should I spend my money for this? Because coming in that often and doing that many types of therapy sessions is a burden on everybody. It's a burden on your staff, a burden on the client. So you should speak with conviction. You should believe it in enough and know from the results that you're going to get conviction, and tell them, hey, you got to do these. This is, mandatory. If we miss something, if something comes up, that's fine, but understand that it's just going to take a little longer. So when it's a healing modality that works at the cellular level, of course, you're not going to stand there and, basically say it's absorbed by cytochrome C and turns it into this oxidizing cytochrome C oxide, giving off nitric oxide, reactive oxygen species, things like that. you're going to just say that it works at the cellular level, that basically it's a healing modality. We're stimulating your cells to heal. We're making unhappy cells into happy cells is what I used to use. And I often used, we reached a plateau in the quality of life of your patient, your pet, and we now have the technology to prove on this without any side effects, without anything at all. And, you know, I made a believer out of them by showing them examples of that. A lot of people that I've heard use photosynthesis analogy where, you know, you put a plant in the dark, it doesn't do so well. You put it in the light, it does really well. Now that's a little bit of a stretch when we're talking about laser therapy here, but it's something that clients understand. One of the best ones I heard, if you've seen the movie Star Wars, is that I heard one doctor, and I didn't prompt him or anything, I just happened to be standing there, and he told the client, it sends the pet cells into hyperdrive. I thought that was pretty good. Clients fear this. Clients are skeptical because they've never heard of this therapy before from their doctor or PT or their own orthopedic surgeries. So you have to educate them. You have to make them understand that this is not Goldfinger's surgical laser trying to cut James Bond in half. This is every opportunity to educate them. And if possible, if you know the client well enough, you have a good enough relationship with them, let them feel it. Let them experience the feeling of what their pet's going to feel. And that helps reduce their fear. And it helps you then allow them to be compliant to your recommendation. You have to train everybody. The therapist, you have to select the right individual in the practice. Face it, laser therapy is a little bit time consuming, but it is also, you know, it takes the right individual to get that warm and fuzzy feeling after they know they've helped that pet, after they know they've helped relieve that pain. Not all of our technicians or therapists or other doctors have that genetic pool that takes to do that. So select the right individual and identify them as a specialist. And basically in our country, you have to have a laser safety officer, you know, training. One of the persons in the clinic has to do it. Usually that sometimes is even the practice manager here. Some of the states requirements, some of it don't. And again, there's certificate training. We offer courses on AMLA that give them certificates that basically they can hang on the wall and reassure the client that we're doing it right. And again, all the way down to the receptionist or front desk staff, they have to be aware that you're offering this and treat their pet. Have them have a success story, and they will mention it to people as they're coming into the clinic, and establish the confidence by treating all the staff-owned pets. I mean, I did that for free because especially when I hired a new technician or a new nurse, I would, you know, bring their dog in. Usually they had an older dog, and I would treat them, and we couldn't believe the difference in their pet. So that made them a believer right off the bat, and then they want to share that with their, you know, people that they talk to and they meet, and the veterinarians too. Have to train the veterinarians. They have to all be on the same page. So examine your fees. Again, raise your surgery fee. In the United States, I've seen people just raise it $5. I've seen it up to $20. I converted that to euros when I was writing this webinar here, but a lot of times it's in the middle of the range here, somewhere around $12, $12 to $15 US is usually the increase. One site in the United States, usually they charge $40 to $60, 35 to 55 euros. Some places more, depends on the area that they're in, the economic state of the area they're in. When I practiced in a rural area, so I didn't get to charge as much as they did down in the Florida area where the people were very wealthy. So again, multiple site treatments, again, you don't charge double what you did for one site, you increase it a percentage or whatever you define necessary, but examine your fee schedule and make sure you're getting a good return on your investment and upgrade it on a regular basis. And again, it's a new profit center for the practice. This doesn't cannibalize any other practice income. So feel free to, you know, create a base of income here, source of income for the practice here using your laser. Example of one marketing technique, clients are more compliant when they prepay for the therapy because they're more than, you know, they're going to show up if they've already paid for it. And so if you prepay 3 treatments, you save 5%, 10%, 15% if you prepay for 9. And I had an idea always about how many treatments it should take. And I would have them pay for at least 1 or 2 ahead of time so that I made them compliant to come back. Chronic hip dysplasia, just to give you an idea here, applied to both hips and the lumbar sacral areas. So 3 sites, aggressive phase, 3 sessions a week, $80, $90 euros for each session. So that's 3 times that, so $240 a week US for 1 week, and then the next 2 weeks twice a week, so $80, so $160 more per those weeks, so $320, and then a maintenance phase of every other week until we establish what the maintenance dose is. So you can see that adds up really fast, but your clients are more likely to write a check for $80 twice than a check for $600 once. And it's like a payment system. And again, you get them to pay ahead one treatment ahead of time, and they will show up for it. And you say, look, here's where we're at right now. We probably need a couple more treatments, and they'll be, I had about a 95% compliance rate that way. So 9 total sessions was 720 US or around 800 euros, and prepay a discount, they saved almost, $100 US, and doing the math there really quickly, they saved quite a bit in euros. Now, marketing techniques. The reception is your front line. So again, she has to believe in it, or they have to believe in it, he or she. And again, you can put photos up, you can put posters in the reception area. This is one of my favorite dogs over on Facebook wearing the laser protective eyewear goggles. In the exam room, you can have photos, you can have your technician or nurse talk to them. Your receptionist tags. Let's just say a geriatric dog comes in. She tags that record so that everybody knows that this patient has not had laser therapy before, or has had before, and maybe we want to expand on that now. But then again, our biggest marketing tools right now are free. Put it on your website, social media, email, newsletters, Facebook. Have your clients take pictures of their pets with the goggles on, and they will put them on Facebook. They will market it for you. So those proven marketing techniques are very, very, basically they don't cost you very much, and they're very lucrative. I mean, they return tenfold what the time it takes to do them. And then I also had handouts for somebody that was wanting more information here. So again, the receptionist on a daily basis, conversation upon first contact, tag the appointment if it involves pain, geriatrics, or orthopedic, hand client a brochure to read while they're waiting. Technician, communicate to the client a message that the attending veterinarian has approved, relate to the client personal experience with this modality, and the veterinarian understand the versatility of this modality and prescribe it. This is our standard of care. This is how we treat this at this clinic. This is how I prefer to treat them. And most of your clients, when they believe in you and have faith in you, if they've come to you for help, they're going to do what you ask. Again, client education, I didn't have all the fancy things. I had a white erasable board in each one of my exam rooms. And I had what will the laser do for you handouts with the permission. Again, I let them feel it. And I would place the patient through range of motion and a lameness test before and show them what I'm seeing. And then after therapy, illustrate the results to the client. An educated client is a compliant client. Remember that. Expansion of services to the current client base. Again, identify those with a personal invitation letter, all your geriatrics. Email campaign, send them an individual email. Nothing makes them feel more special than a specific letter, personal letter from you to the client for an upcoming appointment. Use the internet, use the newsletters. Again, the practice website, list and explain it on the website. It's valuable content for the clients as well as some cases possibly. Does it appeal to new and existing clients? Ask yourself that question when you're writing the text. Social media, again, that should be updated on a regular and even daily basis, posting photos, videos, testimonials, and provide links to other sites that have more information if the client wants it. Learning points of today, a successful practice integration depends on utilizing the versatility in all aspects of the practice that it would be effective pain management, acute, chronic, and regenerative cases. Realization and confidence that laser therapy is now standard of care, and we should be recommending it and prescribing it. Educate and train your staff to recommend laser therapy to the clients, communicating and educating the clients, and understand the various marketing strategies that are available. I have just touched the tip of the iceberg here, but with that, I feel that you should have an idea of how easy this is to integrate into your practice and how well the results will be, and your clients will see it. You want a wow factor from them. I would laser them until I got a wow factor, and that would oftentimes convince them and make them clients for life. So with that, again, I want to thank you for attending. I want to thank Renal Medical for giving me this opportunity. That is my email if you have a question that I'd like to answer, that you want me to answer. And Ramy gave his email at the beginning of the presentation, and that's email at export@manomedical.com, where you can email the company if you want information about their laser. They have a very good laser system that is very applicable to small animal practice and equine practice, both, and has a various amount of hand pieces to it and everything. And with that, I can open it up to questions. So Rami, if you're still there or you're joined back in again, I'm just a little bit over what I thought my time limit would be here. But if you want to ask me a couple of questions, any questions come in during my talk?
Yes, I'm back. I don't know if you can see me. Thank you very much, Ron. That was, as always, very interesting. So as you said, you can send us your question, write to us by email, but we're going to take some time now to answer some of your questions. As I told you before, you have the chat box here and you can send your question. The first question that I always have is about the replay. So the replays of the previous webinars are already on Mano Medical YouTube channel. So you can go there and get access to the replays. And the replay of this webinar will be available soon. And we will send you, to all of you, the attendees of today, we'll send you the link to see the replay from today. Okay, so I have a few questions for you. We're going to try to answer as many as we can. Do I use the same handpiece to treat on contact or off contact?
Yep, that's a very good question, and I'm sorry if I wasn't quite clear on that. There is many handpieces available with a lot of lasers. Mano Medical's off-contact laser has basically where the fiber is off contact of the dermis. The end of the handpiece can be placed on the dermis, but the fiber is off contact. But they also have a handpiece with a rounded head on it that you can put right in contact with the skin. And what that does is it allows a better penetration of the energy through the dermis to the target tissue. Now, if you're treating something superficial, you want to treat them off contact, like a lick granuloma, for example. But if I want to treat, let's just say a deep inside the stifle joint or something like that, I want to treat them on contact because I want all my energy to reach my target tissue. And so there are different handpieces for that. Some laser companies only have an off contact handpiece, even though they say it's on contact. If you look where the end of the fiber is, it's actually off contact to the dermis, and you get a lot of reflection off the dermis that does not penetrate of the energy that you're administering. But they do have a very nice on contact handpieces, and several other companies do also, but this one is very easy to handle. Next.
Okay, very good. I have a pretty long question. Could you please comment or compare MLS lasers in comparison with lasers not called MLS? So do you know what the doctor means by MLS?
Yes, I do. And I would rather them email me that. That is a very long answer.
Okay.
multi laser systems and multi-synchronous wave systems are different. They have a different philosophy. They're not just delivering total energy there. They feeling that their different frequencies and everything stimulate different kinds of tissue. So the difference between this laser and that laser is this is absolutely at on the Mano laser, for example, if you're going to compare that, you can select the wavelength, you can select the amount of treatment time, you can use a preset protocol to start the treatment on it. The other system uses a lot of different ways. All lasers work. My experiences with the MLS laser have not been as versatile as what the other laser systems have been. And I think that is only because of the optics that are on them, but it is a very good laser. But there are some that are out there that I feel, in my opinion, are better, and not just because I'm lecturing for Mano laser. I could show you, and I can elaborate on that further if you want to email me that question.
Okay. All right. So Dr. Simanova, please send us your question, or I'm going to keep it in mind and transfer it to Ron for a longer answer. Okay. So is laser therapy safe to use on areas with confirmed infection or suspected infection?
Well, that's a very good question. Everybody is under the assumption that if something's infected, that we might basically stimulate the bacteria or the yeast or whatever to reproduce even faster, and therefore compounding the infection. What they're not remembering is this works on the mitochondria of the cell. Bacteria do not have a mitochondria. So that is safe to use over infections and everything else because it's not going to stimulate bacterial growth. It's not going to stimulate yeast or fungi growth. Those organisms do not have a mitochondria, therefore the mechanism of action does not stimulate those. So it is very safe to use over an infection. That is a very good point that somebody made there.
Okay. Very good, thank you. How long does an average treatment take?
Well, again, it depends on what laser you have, but most of the time with the, and again, I'm going to refer to the Renal laser here, they take a few minutes. I mean, it's not very long at all because we want to have enough power there to deliver the treatment in an efficient amount of time. You can't spend an hour doing the lumbosacral area and the 2 stifles of one patient. You want to be able, if I had to treat all those 3 areas, I could easily do it in less than 15 minutes, probably more like 10 to 12 minutes. So the treatment time is very economical, depends on the power of the laser and where the site is you want to treat. But most of the time, in general, the answer is minutes, not tens of minutes or hours.
Okay, very good. So maybe we can take 1 or 2 last question. If you want to write down 1 more questions, maybe we're gonna take it because it's almost time. How do you come up with the dosage?
Okay, the dosages are based on basically the research that's out there right now. I had to do, we have over 1,100 references in the textbook that I edited, and also personal experience. We all started with very low dosages, and a lot of, the early works were at low dosages, and that's why it was called low-level laser therapy there for a while, because it was low dosages. But we found that with the correct optics and everything, that we can administer higher dosages and get a better response and have more things respond clinically to laser therapy. So the doses have become not only from the literature, but also from personal experience, and comes from, we had 31 authors on that textbook, and without any prompting at all of us came, when they submitted all their chapters and everything, were almost always on the same dosage level. So the dosages I gave there are kind of an average dosage out of what's in the literature and what is from the field.
Okay, I see. Very good. So we are done with the hour. The time flies when we listen to you, Ron. It's always a pleasure and always so much education and so interesting. So I'd like to thank you again, Ron. Thank you so much.
You're very welcome. I enjoy doing these. You know that.
Okay. For the ones that maybe will be traveling soon, I know that I will be meeting Ron. I'll be lucky enough to go to the Las Vegas Congress at WVC, sorry. And so if you're flying there also to go to this Congress, you will get the possibility to see me and the pleasure to meet Ron. So thank you to all the attendees of tonight. Don't forget to come up with your questions to register for the next webinar that will be in April. And I hope to see you soon. Thank you again, Ron, and have a great evening.
Thank you. Thank you all.
Bye-bye.